Endometrial cancer doesn't always make headlines, but for women, it's one of the most important cancers to understand. In the United States, it's now the most commonly diagnosed gynecologic cancers. Cases have risen by more than 50% since the 1990s. What on earth is going on? Is it hormones? Is it diet? Is it stress? Is it inflammation? Using your body's own immune system to jack it up, to ramp it up, to be able to help your body fight cancer. It's almost the most natural way you can think of fighting cancers. A study looking at 200 patients with cancer found that those people who responded all had WHIM, and the people didn't respond well to immunotherapy. And we're missing it. This one bacteria actually has a powerful, beneficial effect by helping your body respond to immunotherapy to tackle cancer. The main drivers for cancer, 90 to 95% of cancers, are due not to genetics, actually, are caused by endometrial cancer. Doesn't always make headlines, but for women, it's one of the most important cancers to understand. In the United States, it's now the most commonly diagnosed gynecologic cancer. So it's a cancer of the reproductive system. Now, decades ago, like when I went to medical school, doctors once regarded endometrial cancer as a good cancer, meaning that it was considered to be slow growing, usually occurred after menopause, and oftentimes was caught early. But that's not the case anymore. Endometrial cancer is an increasing cancer, and it's gotten more deadly. In fact, cases have risen by more than 50% since the 1990s, and now it's showing up in women who are decades younger than before, sometimes in their 40s, seconds, and even in their 30s, seconds. What on earth is going on? Is it hormones? Is it diet? Is it stress? Is it inflammation? Or is it something else entirely? Today, I'm going to explore what science is revealing about endometrial cancer, who's at most risk, the latest important treatments, and how you can help your body defend itself to prevent endometrial cancer. You ready? Let's go. First, let's talk about the endometrium, all right, because you need to understand that to understand endometrial cancer. The endometrium is the lining of the uterus, all right, and endometrial cancer is a cancer that arises from that lining. Normally, the endometrium is a part of the woman's body once they reach reproductive age, because that lining forms every single month, grows, and it thickens through a process called angiogenesis. Angio, blood vessels, genesis, how they grow. This lining of blood vessels grow inside the uterus in order to prepare the uterus to accept a fertilized egg for pregnancy. And this lining would, if there's a pregnancy, will develop into a life support system for the baby growing in the womb. And if there's no pregnancy, then every month the uterus, the woman's body, will shed that endometrium at the end of every month. And that's what happens during menstruation, okay? You're shedding out that lining, that endometrial lining. So what is actually going on? Well, over decades of hormonal cycling, right? So you think about it from teenage years into your 20 seconds and 30 seconds and 40 seconds. This is decades now until you get menopause. Those cells are regenerating themselves thousands of times. Now, most of the time, the problem of growing new endometrium, shedding it, growing it again, actually is something that is tackled naturally by the hard wiring in the reproductive tract. The process is usually pretty smooth. The endometrial grows and it sheds. Everything runs normally, smoothly. But if there's a disruption of hormones, if there's inflammation, if there are toxic exposure, including to carcinogens, if there's DNA damage of the cells in that endometrial lining, well, those insults, those mistakes can cause DNA mutations. And DNA mutations to the endometrium can lead to cancer of the endometrium or endometrial cancer. That's what we're talking about today. So how would you know if endometrial cancer was present? Well, actually, it's kind of a silent cancer. It can let you grow silently for a long period of time. You may not know it until there's bleeding, but there are symptoms that every woman should not ignore because it could be a sign. For example, in younger women, bleeding between periods or unusually heavy periods or any bleeding at all after menopause can indicate that there's something going on in that endometrium. Okay, other symptoms that might be a signal that there's a problem going on: pelvic pressure, bloating, especially in sort of the lower abdomen in a pelvic area, pain during intercourse, or unexplained fatigue, or a super low blood count, anemia that your regular primary care doctor might detect. Those are actually potential clues that something's going on down there in the reproductive tract that needs your doctor to help you check it out. Now, in most cases, what a doctor would do is a quick history and a physical exam. And if there's enough concern, quick office biopsy by a gynecologist can usually spot the problem, right? And when you catch endometrial cancer early, like most cancers, it's more likely that you're going to be able to get it treated successfully. Early detection almost always leads to a better, more successful outcome. Okay, now earlier I mentioned that the cases of endometrial cancer are rising. And the question is, why? Why is this rate of this cancer rising? Well, let's first look at what the risks are for endometrial cancer. Most people think about genetics when it comes to cancer, right? Because there's been huge awareness about the importance of doing genetic screening for cancer. And that's a good thing. And in fact, for endometrial cancer, there is one genetic inherited cause for endometrial cancer to know about, and that's called Lynch syndrome. Lynch syndrome. That's a genetic syndrome that weakens the body's ability to repair any DNA damage. And of course, that can lead to certain cancer, including colon cancer and endometrial cancer. About 3 to 5% of endometrial cancers are due to Lynch syndrome. All right. And if you're a woman and you carry this genetic mutation for Lynch syndrome, the lifetime risk of developing endometrial cancer can be as high as 60%. That's why if you were tested and you had the gene mutation for Lynch syndrome, it's worth talking to a genetic counselor, then to your gynecologist to talk about what the options are for preventing endometrial cancer in the future. Now, again, simple genetic testing can catch this risk factor, and then you can actually go forward from there to figure out what's the best thing. Now, if anyone in your family has had a history of colon endometrial cancer, especially at a young age, it's worth getting checked out for Lynch syndrome. However, the vast majority of cases of endometrial cancer are not inherited or not genetic. That's because like most cancers, the main drivers for cancer, 90 to 95% of cancers, are due not to genetics, which are only attributable to 5 to 10%, but actually are linked to caused by the environment, diet, lifestyle over many, many years. And this is why it's possible that you can take control over your own risk factors. So again, let me repeat this. Only 5 to 10% of cancers are caused by genetics, whereas 90% of cancers are caused by repeated insults from the environment, from diet and lifestyle, right? And by the way, these are the same things, environment, diet, lifestyle, that are also the underlying insults that cause other things like obesity, diabetes, cardiovascular disease, maybe even some forms of dementia, neurodegeneration. Now, what's at the heart of all of this is inflammation that goes on in the body. And inflammation, like in other parts of the body, when it comes to cancer, acts like gasoline being poured onto a fire. It really causes the disease process to flare up and actually makes it a lot more aggressive. So, diet and lifestyle that can reduce your risk of end of cancers and other chronic conditions are important to know about for endometrial cancer. Now, before I talk about diet and lifestyle, there's another thing you need to know when it comes to endometrial cancer. That is your gut microbiome, right? So this is where you know this field of healthy gut bacteria is growing and percolating and getting to almost every area of health and medicine for understanding disease. Turns out that there is a part of the gut microbiome that is known as the estrabol. Okay, estrobolome sounds like estrogen, and exactly that's what it actually controls your hormones. Going to come back to that in 1 second. So your gut microbiome, 39 trillion healthy bacteria living in your lower gut, does play a role in reproductive health and in resisting cancer. Your microbiome, healthy bacteria, regulate your metabolism, makes your body more insulin sensitive to lower your glucose level. Your gut microbiome raises your immune shield so that your immune system is better able to spot and destroy cancers. And your microbiome also influences your hormonal regulations in your body. So when your gut bacteria are in a balanced community, healthy communities, good neighborhoods, everything seems to function just fine. But when you have disturbed community, call it dysbiosis, this is when you have bad guy bacteria that enter the neighborhood. Whoops, there goes the neighborhood, and it disrupts the good functioning neighborhood. You wind up actually having more bad bacteria than good bacteria. And some of those bad bacteria in dysbiosis can cause problems, including inflammation, right? Part of the healthy microbiome called the estrabolome helps your body process and clear estrogen when it comes to women. Now, think about it as an estrogen recycling system. Reproductive organs make estrogen. The estrabol in your gut, we now realize, helps to process and clear it out, making room for the new estrogen that's actually produced. So extra estrogen is broken down and eliminated. So how does this connect back to the gut microbiome? Well, I told you the gut bacteria will be helpful in regulating and recycling extra estrogen. So it clears it right out. But if you have dysbiosis, this is gut bacteria that's not functioning in a good, harmonious way. Not only do you have inflammation, but you have disruption of the estab. And when the estrabal is disturbed, and this is all happening in your gut, the bacteria that degrade and help the estrogen to get recycled, they're not functioning. They're compromised. All right. And estrogen isn't degraded as much, and it builds up higher and higher levels of estrogen. It sticks around. Now, when you actually have higher and higher levels of estrogen plus inflammation, and both of these are being exposed at the level of the endometrium, what do you think happens? Well, this is thought to be a risk factor for endometrial cancer. Increasing inflammation, higher levels of estrogen. Now, other insults that could be coming from diet and lifestyle then is a setup over a period of time for increasing the chances that some of those cells in the endometrium could become cancerous. And that's why we now are beginning to think that a healthy gut is important, not just for lowering inflammation and helping your metabolism and helping brain health, the gut-brain axis, but in fact, this gut hormone axis, the estabome, is really, really important for understanding some of the underlying risk factors for endometrial and other reproductive cancers as well. So gut health is obviously important. Come back to actually how to improve your gut health. Before I do that, though, let's just talk about treatments, right? Because I'm a physician, so I think it's important to talk to people about what the medical approach is for endometrial cancer. And the good news is that there are treatments, but the treatments depend on the stage of cancer, when it was discovered, how aggressive or how much widespread it's become. And in the medical community, we sort of try to partition off the stages of cancer when they're discovered so we can figure out what's the best way to help a patient overcome their disease. So, for example, many of you will have heard about stage 1 or stage 2 cancer. This is earlier cancers, basically, where the cancer is limited still, restricted to the organs where they arise, like uterus. All right. And in these situations where stage 1 or stage 2 endometrial cancer, surgery, which is usually a hysterectomy, maybe removing the uterus and maybe removing the ovaries as well, that can actually be curative, right? Just remove the uterus and now you don't have any more chance of getting endometrial cancer. And if there's anything there, you remove the whole thing out. Just the whole kit and caboodle comes right out. That's stage 1 and stage 2. Stage 3 is where the cancers spread to the pelvic lymph nodes. The pelvis is, an area around the hips, that whole area of pelvis. The uterus is right in there. And lymph nodes are where cancer cells first tend to go, right? Because the lymph nodes take cells and fluid right out from different organs to try to reclance the lymphatic tissue. It's a kind of a cleansing system, like a sewer system. Cancer cells get washed out there. They get caught in the storm drains of your lymph nodes, and then they stick there and they can grow. Now, surgery is still the best treatment for most stage 3 endometrial cancers because it's in the lymph nodes. Usually add some radiation to zap the cancers in the lymph nodes, or maybe some chemotherapy to try to clean up any cancer cells that are sticking around inside the lymph. That's stage 3. So we talked about stage 1, stage 2, stage 3, and of course there's stage 4 endometrial cancer. And this is where the cancer has spread not only beyond the uterus, but actually distant organs like the liver or the lung or elsewhere, And by the way, traditionally, and we still think this, stage 4 cancers are, really regarded as serious, advanced levels of cancer. But until recently, we thought usually stage 4 was effectively untreatable. That's changing now because today, cancer treatment isn't just based on the organ in which we started. We don't just use chemo or radiation or surgery. Now, we're actually beginning to try to personalize the treatment for the individual, right? You've probably heard of personalized medicine. Well, personalized oncology is how we actually really fine tune the approach to the cancer based on that individual. And one way that we do this is by looking for molecular fingerprints. Let me explain how this is done. Basically, when you do surgery or do a biopsy, you're going to get a piece of the tumor out, and you can test that piece of the tumor, the cancer, for mutations and immune markers. And looking at these mutations or immune markers actually allow us to compare what we find in the lab, at the pathology lab, really to the toolbox that is growing now of the right treatment for your specific cancer. That's personalized therapy. For example, we know that some cancers are driven by hormones, and hormonal therapy could be actually the right solution. That's matching. And by giving hormonal therapies that interfere with the hormones, sometimes you can actually slow the cancer growth, especially if it's fueled by estrogen. Other cancers have a genetic mutation, for example, a molecular signature like PI3 kinase or HER2. Might not have heard about those. Maybe HER2 you've heard of. Well, this is where when we find those mutations, those telltale smoking guns in the cancer, we're able to go over to the toolbox and reach out for what we call targeted therapies that are directed exactly at the PI3 kinase or HER2, right? There's also anti-angiogenic therapies, which I've been involved with. And these are treatments that are not chemo, not radiation, but they actually cut off the blood supply feeding the cancer. And it can be a really powerful way to enhance the cancer treatments. Now, there's another really amazing pillar of therapy called immunotherapy. Immunotherapy, it's got an immune part of it, is exactly using your body's own immune system to jack it up, to ramp it up, to be able to help your body fight cancer. It's almost the most natural way you can think of fighting cancer is just to help your own immune system scrub out the cancer. This is not chemotherapy. All right, chemo basically just destroys everything in this bath, including cancer cells. Immunotherapy is waking up, jacking up your own immune system. And sometimes it's a medicine that is given to stimulate the immune system. So the immune system is kind of waking a soldier out of bed to say, hey, we got the enemy coming. Let's go out after them. And they go pick up their weapons to go out after to hunt the enemy. Or sometimes you take immune cells and you grow them up and you supercharge them. Then you give the supercharge immune soldiers back to the individual, the patient, in order to be able to go off to fight the cancer. So different ways of actually approaching immunotherapy, but this is really where the end of cancer is going to be coming from, is immunotherapy. This has been a kind of a pipe dream for decades. It was proposed many decades ago. Finally, after a lot of research and a lot of work, we now finally have immunotherapy. So I'm telling you this for endometrial cancer because I want to just communicate that there are many different treatments. There's no one size fits all. And today, oncologists, cancer doctors are trying to individualize the treatments and picking from all these tools in a toolbox to match it to each person's individual situation. So the type of immunotherapy I think I want to share in this video are called checkpoint inhibitors. All right, checkpoint inhibitors. And basically, this type of immune therapy, checkpoint inhibitors, pretty much just takes the foot off the brake that the cancer puts on your own immune system. So cancers are pretty sneaky. They can figure out how to actually, make your immune system screech to a halt and avoid tackling the cancer. So these checkpoints are exactly how tumors are able to block your immune system. So they send proteins called PD-1 or PD-L1 that basically tell the immune system, hey, don't attack me. All right, leave me alone. Then your immune system just kind of keeps on going and it completely ignores a cancer. Not what you want. You want your immune system to go after that cancer. So these proteins, PD-1, PD-L1, essentially help a cancer become camouflaged. Like put a cloak, some camouflage over the cancer. So they avoid the immune detection checkpoint inhibitors. Right now, there are a growing number of checkpoint inhibitors. You might have heard about some of them. I'm just going to tell you the names so you've heard it from me. One of them is called pembrolizumab. The other one's called nivolumab, okay? Basically what these checkpoint inhibitors do, immunotherapies, they turn off the cancer's cloaking device. they target and inhibit PD-1 or PD-L1, right? So now, once the camouflage or the cloaking system is turned off, all of a sudden, your immune system can see clearly. There's a cancer there. And what do? They go and attack the cancer, kind of like guard dogs going after a criminal, right? So now, this is not just true for endometrial cancer. It's actually true for any type of cancer, but we're talking about endometrial cancer. And I can tell you that checkpoint inhibitors, this type of immunotherapy, has been used effectively in some people who have endometrial cancer, right? So why am I telling you all this? Because if you are a cancer patient with endometrial cancer, or you know somebody who's dealing with endometrial cancer, what I always tell people is that very important today for the patient, cancer patient, to ask their oncologist or cancer doctor following question: can I get an immunotherapy? What do I need to do to figure out if I can get an immunotherapy? Have you checked my tumor for markers like PD-1 or PD-L1 that might reveal that my tumor can respond to a checkpoint inhibitor? Very, very important. You don't want to actually go to that kind of an oncologist who basically just does the box check on chemo because that's what they're used to. You really want to connect with your oncologist to engage them in this very exciting area that the future of successful cancer therapy is coming from, right? We're beginning to see it all around us, but a lot of oncologists are still not using them the way that everyone's going to be treated with immunotherapies in the future. Now, obviously, I'm not giving medical advice. I'm here as a physician to give education, to help give you information that can empower you so that you can work with your own doctor to be able to ask these important questions. But I'm just telling you, immunotherapy is one of those treatments that you can't afford not to ask your oncologist about. All right, let me kind of boil it down for you in a way that I think you're going to remember. Cancer. How do we used to treat it? Chemotherapy. Chemotherapy kills cancer. Also kills a lot of other healthy cells as well. Chemotherapy kills cancer. Immunotherapy heals the patient. Chemotherapy kills the cancer. Okay, immunotherapy heals the patient and restores them to health. Big difference. This is something that you really want to know about, is immunotherapy. Now, there's something I want to loop back on, and that's gut health. Because it turns out that if you're getting immunotherapy for cancer, like these checkpoint inhibitors, like pembrolizumab or nivolumab, you want to make sure that your gut microbiome is in good shape. Your gut microbiome should be in good shape, a healthy bacteria, so that your body can respond properly to immunotherapy like these checkpoint inhibitors. Because research has shown, clinical studies have shown, that people with cancer getting immunotherapy respond better when they actually have a healthy gut microbiome. In fact, if they've got a healthy bacteria, one of them is called Akkermansia mucinophila. Okay, some of you may have heard me talk about this before. A study looking at 200 patients with cancer found that those people who responded all had Akkermansia. The people who didn't respond well to immunotherapy, they were missing it. All right? So this one bacteria actually has a powerful beneficial effect by helping your body respond to immunotherapy to tackle cancer. Now, Akkermansia is also what we call a keystone bacteria that helps you have a good metabolism. It helps your body become insulin sensitive, can even help your body produce GLP-1, that's satiety hormone, right? That can cause weight loss as well. But in this case, we're talking about cancer. What we found is that having this Akkermansia can help your body respond to immunotherapy. Very, very important. Okay, so how do you know if you've got Akkermansia? That's a question that I sometimes ask by people. Well, you got to get your gut microbiome checked. You should ask your oncologist and your regular doctor if they can help you order a gut microbiome test. You got to ask them. All right. Now, most doctors are not yet familiar with microbiome testing, but maybe if you have a functional doctor or functional oncologist, they will have one. All right. They will have a test that they've used before. If your doctor isn't able to help you, all right, it is possible for you to do the research yourself online and order a gut microbiome test yourself. All right. This is an area where, honestly, the general public is ahead in some cases than doctors. But fortunately, you can actually order your own gut microbiome test. So that's one thing you can do to find out if you have Akkermansia. You should just make sure the test will actually look for acromantia. So you can do some research, is make sure that the company will actually reveal whether you have acromantia or not. You can also take a probiotic called acromantia. There's a pendulum acria probiotic that is very, very high quality. I have studied it myself in cancer patients. This probiotic will raise acromantia levels, and it's available, and it does improve acromantia in the gut. All right, so if you want to support acromantia gut, you can take a probiotic in order to amplify what your gut might naturally have. And what you can also do is to eat foods that support acromantia and gut health in general. Now, specifically for acromantia, this is the bacteria that loves to feed on natural mucus called mucin in your gut. So if acromantia eats a mucin, foods that you eat that can actually make your gut secrete more mucin will grow more acromantia. And so the foods that will do this are the ones that have polyphenols called elagitannins. So which foods are those? Pomegranates, dried cranberries, concord grapes. These are the foods that will nurture acromantia by giving your gut the stimulation to create more mucin. So acromantia will feed on it more. You'll have more microbes, healthy gut bacteria around. So what I'm just telling you now is you can use food not just as medicine, but food and medicine.